So when can I sleep on my side? That is the question. Almost every hip replacement patient asks me before their surgery. Here's the answer. Not week 6, not after some checkpoint I clear you through, whenever it's comfortable for you. And I know that's not what you've been told. So today, the 5 sleep mistakes I see after hip replacement, starting with the one that costs people the most sleep. Before the list, one piece of anatomy, because it helps explain what I'm about to talk about. I use the anterior approach for almost every hip replacement. Anterior means front. So your incision sits over the front of your hip, right where about your front pocket would be. Nothing on the side, nothing on the back, which means when you roll onto your side at night, you're not lying on your incision from an anterior approach. That's why I let my patients sleep on their back, on their side, even on their stomach, if that's what you like. Curled up in a fetal position, totally fine. The only thing I ask is the same thing I tell everybody after hip replacement, and that is avoid the extremes of motion, like putting your ankle behind your head. So whether you're awake or asleep, don't do that. There's a whole video, by the way, on that precaution, and it's linked below. But first, mistake number 1, following hip precautions that were never yours. So you've heard these old rules, lie flat on your back, use a wedge pillow with your legs strapped in. Those come from a prior area of posterior hip replacement. And I don't really know anybody who does that now, especially the wedge thing, not even surgeons who prefer the posterior approach. I personally don't mandate a pillow between your knees at all. Not one of my patients gets told to sleep with one. Now, if a pillow between your knees feels good, sure, use it. And some people love it. For other people, it makes things worse and they end up fighting it all night. So it's a comfort tool. It's not a precaution. And that's the whole point. If you're forcing yourself into a position you hate because of a rule that probably nobody even gave you, you're just losing sleep for no reason. Okay, mistake number 2, forcing a position before your incision is ready for it. Here's where your approach actually does matter. With an anterior approach, like we were talking about earlier, the incision's kind of out of the way. So sleeping on the side is usually comfortable very, very early. The posterior approach is a little bit different, and this surprises people. It's called the posterior approach because that's how we get into the hip from behind. But the incision itself largely sits on the outside of the hip, on the lateral side. So laying on that side can genuinely be sore for a while. When I was doing more posterior approach hips, I'd typically tell people to wait until the incision was fully healed. So maybe that's a couple of weeks. Not because anything would break per se, I'm just trying to give the incision time to heal safely. And even then, it was mostly gauged by comfort. When the incision is on the side, you don't want to lay on that side anyway. So here's the rule that covers every approach. Let pain be your guide. If it's really sore to sleep on one side or the other, it's probably a little too early for you. Try again in a few days. Your body is not being stubborn, it's being informative. And ask your own surgeon what approach you had, because it does change the conversation a bit. Mistake number 3, expecting sleep to be a freebie because it's just a hip. Sleeping after a hip replacement is usually way easier than after a knee replacement. That's totally true. But easier does not mean free. Here's how I like to explain it to patients. Under the skin now, after your surgery, your body is running a race. It's aggressive. It's rebuilding tissue. It's working around the clock. And that effort charges your body up. I mean, physiologically. It can even run up your body temperature a little. I'm not talking about a dangerous fever. You need to call your doctor about that. I'm talking about the body just being revved up. And a revved up body does not fall asleep right away, does not fall asleep on command. So if you're 2 weeks out and sleeping poorly, nothing's gone wrong, probably. That's the process, and it's temporary. For most of my hip patients, by weeks 3 or 4, they're sleeping pretty comfortably. Knees can take a little bit longer, and like I said, that's a different video. Now the flip side. I had a 72-year-old patient recently who had all kinds of questions about sleep before her surgery. It's normal. She came back at 2 weeks after her surgery, though, and told me she had been sleeping through the night almost right away. That happens. It just isn't everyone's experience. And this is where I'd ask you to be careful. Avoid the comparison game. There is always somebody in your life or on a Facebook group who slept like a baby right away. Their recovery is not your scorecard. Mistake number 4, taking a narcotic pain medicine in order to fall asleep. Patients tell me all the time that their pain medicine helps them sleep, and they're half right. A narcotic pain pill will absolutely help you fall asleep, but what it will not do is give you good sleep. Opioids themselves, so the narcotics, disrupt sleep quality. They cut into your deep sleep, that restorative kind of sleep, and push you into lighter stages of sleep. That's been measured in a controlled sleep lab study in healthy patients many times over. And it's consistent with what patients describe to me. A full night in the bed, but they don't feel rested. Somehow it just didn't count. So I'm careful about how I say this. Take your pain medicine for pain. Don't take it as a sleeping pill. If pain is what's waking you up, that's a real conversation to have with your surgical team. But I took it so I would get knocked out is a trade you don't want to make. Mistake number 5, reaching for a prescription sleep aid or sleep pill to get through it. This is the one people ask me for by name. It's Ambien. I don't prescribe Ambien or really any of those sleeping pills. And it's not because I don't believe you're struggling. It's because your body can start to rely on them to fall asleep very quickly. That's what I mean when I say they can be addicting. It's not a moral thing. It's a dependency thing. It's a physiological dependency. So if you're 4 weeks out and you're going to be sleeping on your own, I don't want you to be attached to a pill at week 4, 5, or 6 just because we started taking those pills in weeks 1 and 2. And I'll say the obvious one out loud. Never stack a sleep aid on top of a narcotic pain medicine unless your doctor has specifically told you to. That combination, the narcotic plus the sleep aid, is the one that actually scares me. So, what do you do instead? Stay ahead of the pain, hopefully with your anti-inflammatories and Tylenol. Ice the area. Always use a barrier if you're going to use ice. Don't burn the skin. And over-the-counter and supplement kind of things that you can try. I went over all that in detail in my video on sleep after knee replacement because the knee is where most people really, really struggle. But it's the same medicine conversation here, and the video for that link is below. So a quick recap of what we talked about today. 1, don't follow precautions that were never yours. No mandatory pillow, no wedge, no lying flat on your back for 6 weeks. Number 2, don't force a position your incision isn't ready for. Let pain be your guide and know which approach you had. Number 3, don't expect it to be free. Your body is running a race there after surgery, so it can be 3 or 4 weeks before sleep returns to normal. Number 4, don't use a narcotic pain pill for a sleeping pill. And number 5, don't use a prescription sleep aid. Sleep after hip replacement can be a struggle. It is also one of the things, though, that can get better really, really fast. The full write-up is in an article that's also linked below. And I kind of want to hear, which side do you end up sleeping on, and how long did it take you to get there? Your operative side, the other side, something else? Tell me in the comments. Thanks for watching.